NoirPlasmaChromeBleed. Unlocking knowledge, inspiring innovation, empowering curious minds.
This website makes learning so easy. I found all my resources here.
Like what you share.
The human vertebral column is the central structural axis, comprising 33 embryonic segments. It matures into 24 mobile vertebrae, alongside the fused sacrum and coccyx. A vertebra is divided into two sections, an anterior body and a posterior arch. The body bears the axial load, and laminae that form a protective ring. This encloses the vertebral foramen. Alignment of these foramina forms the spinal canal. 7 distinct bony processes arise from the arch. Facet joints guide movement and prevent displacement. The neuroforamina are formed between the pedicles of adjacent vertebrae. These pathways are bounded by the discs and joints. They serve as critical exit paths for spinal nerve routes to the periphery. The vertebral column has 5 regions. The cervical region has 7 vertebrae to C7. These feature transverse foramina and spinous processes. Nerve C8 exits in. This regurgitizes head motion. The thoracic region contains 12 vertebrae, designated T1 through T12, and that anus processes. Spinal nerves exit through the notches, maximizing stability and protected. The lumbar region consists of 5 distinct vertebrae, designated L1 through L5. They feature massive, kidney-shaped bodies to absorb high axial loads and lateral bending. The sacral region consists of 5 fused vertebrae, designated SON to S5, forming a fused, triangular structure, transmitting upper body weight to the pelvis. The coccygeal region, or tailbone, consists of 3 to 5 fused segments. Though vestigial, to supply pelvic tissues. It anchors muscles and supports sitting.
The notochord coordinates development starting in the 3rd week. It secretes critical morphogens, including sonic hedgehog. It develops into the central nervous systems.
The paraxial mesoderm organizes into somites. Each somite differentiates into a dermomyotome and a sclerotome. Each sclerotome undergoes a fundamental resegmentation process. Sclerotome clusters fuse to form the centrum. The intervertebral disc develops in the zone between them. Cells organize into fibrous annulus fibrosus, while the central notochord becomes the nucleus. Vertebral patterning is governed by HOX genes. Signaling failures can cause severe congenital anomalies, such as the clinically diagnosed Vactorel association.
Other structural errors include spina bifida, where the spinal cord herniates dorsally. This results in profound motor deficits. Failures in segmentation cause scoliosis.
Vertebral ossification begins at week 6. 3 primary centers appear by week 8. After birth, 5 secondary centers develop. Complete fusion occurs by age 26. Intrinsic back muscles align in 3 distinct layers. The intermediate layer comprises the erector spinae group. They provide postural support and assist in flexion. The deep layer occupies the space between the transverse and spinous processes. It includes the semispinalis, the multifidus, and the deepest group, the rotators.
The deep suboccipital muscles attach directly to the skull, providing precise movement and stabilization. Intercostal arteries branch from the thoracenal-iliac arteries. The venous drainage of the spine is handled by the internal and external vertebral venous plexuses. These plexuses empty into segmental, while the inferior vena cava and azygos system.
The nervous system is organized into the central spinal cord and peripheral nerves. It begins at the brainstem and terminates at the conus medullaris. Below this lies the cauda equina and the filum terminale. The vertebrae, meninges, and local spinal ligaments receive sensory and autonomic innervation. Medial branches supply the zygapophyseal joints and the deep multifidus muscles. The cervical spine supports the head. The atlas and axis form the junction. The ring-shaped atlas lacks a vertebral body, the occipital condyles. This joint facilitates sagittal nodding. The axis is characterized by the superiorly projecting dens. It is secured by the strong transverse ligament. Hyperextension can articulus. This carries a high risk of spinal cord injury. Lower cervical vertebrae C3 through C7 possess small, wide bodies. They feature superior concave and the vertebral artery enters CUC1. The C7 segment is a transitional vertebra. It features a long, prominent, non-bifid spinous process. Its trans is smaller. It transmits only a vein and sympathetic plexus.
C3 to C7 feature upwardly projecting uncinate processes. They form the uncovertebral joints. They limit lateral bending and guide coupled rotation.
Hypertrophic changes at Luschig's joint can cause foraminal stenosis. This can compress the nerve root and vertebral artery.
Residing the cervical spinal canal are 8 pairs of cervical spinal nerves. The C1 through C7 nerve rootlets exit through the sutures of their corresponding vertebrae.
The thoracic spine prioritizes stability over mobility. Typical vertebrae feature heart-shaped bodies and circular foramina. Costal facets allow ribs to articulate. Small disc height further limits movement. T1 features a complete superior costal facet for the first rib. It has an inferior demive C7. T9 frequently lacks an articulation with the 10th rib is unnecessary. T10 has a single pair of complete costal facets. T11 and T12 facets are on the pedicles. T12 serves as a transitional vertebra. Thoracic spinal nerves control distinct regions. T1 and T2 branch into the tree through T-chest wall. Nerves T6 through T12 supply the abdomen, supporting balance and coughing. The lumbar vertebrae are massive and kidney-shaped. The transverse processes are long and slender. On each superior articular process is at the base of each transverse process. The mammillary processes serve as critical insertion sites for the deep stabilizing fascicles of the multifus. The L5 vertebral body is also wedge-shaped, which helps establish the lumbosacral angle.
L1 to L3 power the iliopsoas. L4 mediates the patellar reflex. L5 innervates the gluteus medius and provides sensation to the foot.
The sacrum is formed by 5 fused vertebrae. Its base features the broad sacral ala. Transverse lines indicate where these bodies fused. The sacral canal houses descending nerve roots.
The posterior wall of the sacrum features vertical crests. The median sacral crest is formed by fused spicular processes, serve as attachments for muscles and ligaments. The coccyx consists of 3 to 5 fused vertebrae. It's an anchor for the gluteus maximus and other muscles. Along with the ischial tuberosities, it forms a weight-bearing tripod. This tripod helps support and distribute body weight. For C2, pedicle screw placement is viable. From C3 to C6, small size makes it difficult. At C7, viability returns with favorable angles. At T1, pedicles are thick, averaging 20 millimeters. T4 pedicles are the shortest, requiring precise screw trajectory. Width increases distally, making T10 highly viable. At the L1 level, the average pedicle length ranges from 22 to 24 millimeters. The L5 pedicles are broader, measuring 26 times significant medial angulation. According to Fryet's laws, spinal motion is coupled. In the cervical spine, lateral bending automatically rotation occurs to the exact same side. This is due to the oblique orientation of the facet joints. In the thoracic and lumbar regions, these movements follow Fryet's laws. When the spine is in a neutral position, lateral is accompanied by axial rotation of the vertebral bodies to the opposite side.
In a non-neutral position, lateral bending couples with rotation to the very same side. This forces a same-side pattern.
Transitional junctions are highly susceptible to developmental errors in segmentation. The most common anomaly is a lumbosacral transvisional vertebra, or LSTV. LSTV is caused by a failure. It is linked to mutations in HOX10 and 11 genes. In sacralization, L5 fuses to the sacrum. This represents a cranial shift in patterning.
In lumbarization, S1 acts as a 6th mobile vertebra. Sacralization of L5 transfers stress superiorly, forcing L4-5 to become hypermobile.
LSTV creates a false joint. This causes contralateral hypermobility. Grinding causes pain and pinches nerves. This complicates surgical planning. We use the Castelvi scale.
Castelvi type 1 features a dysplastic transverse process. It measures at least 19 millimeters in width, while 1B is bilateral. These represent a mild form of transitional hypertrophy.
Castelvi type 2 represents incomplete sacralization. An enlarged type 2A causes asymmetric lateral bending, resulting in pseudo and contralateral facet overload.
Castelvi type 3B represents complete bilateral sacralization. This osseous fusion eliminates all motion at the L5-S1 joint. This transfers significant strain to the L4-5 level.
Castelvi type 4 is a mixed presentation. It features a unilateral pseudoarthrosis and a complete osseous fusion on the opposite side, creating highly asymmetric spinal mechanics.
The vertebral column features 4 sagittal curvatures. Primary curvatures, or kyphoses, are present during fetal life. Thoracic kyphosis is concave anteriorly from 20 to 50 degrees.
Secondary curvatures develop after birth. Cervical lordosis appears as an infant holds its head up. Lumbar lordosis forms later during sitting and walking, centering the trunk over the limbs.
Pathological alterations of these curves can cause significant structural deformities. Kyphosis is an excessive curvature.
Lordosis, often called swayback, is an excessive curve in the lumbar region. Notice the exaggerated anterior pelvic tilt. Strengthening your core can help fix this alignment.
Scoliosis is a 3-dimensional curvature. It involves both lateral deviation and rotational twisting. This rotation causes the ribcage to protrude. It is most common in adolescent females.
Spine is a highly integrated system, from the mobile cervical spine with its specialized joints to the rigid thoracic cage and massive lumbar vertebrae. Each region is adapted to its environment.
Embryological patterning establishes complex spinal segmentation. Pathological variations like hyperkyphosis disrupt alignment. Care requires understanding the column.
Like what you share.
NoirPlasmaChromeBleed. Unlocking knowledge, inspiring innovation, empowering curious minds.